Today's guest is Jannik Schuster, Neuroathletic performance and pain coach, MSc in sports science, educator and former elite footballer. After training in a youth academy of FC Augsburg and a professional squad of FC Schweinfurt, Jannik discovered Neurocentric training as a breakthrough method to unlock performance, prevent injury and resolve pain. Educated through Z Health and grounded in sports science, he now helps others apply neuro-based strategies for pain-free movement and optimal function. Hi Yannick, welcome to the pod.
Hi, thank you. I'm really honored to be here. I'm excited to talk about neuroathletic training.
Yeah, great to have you. It's an interesting topic. Hey, and let's start talking about your background. You grew up as a competitive athlete. How did you first come across neuroathletic training and what convinced you of its value?
The first time I met neuroathletic training was when I'm like 18, 19 years old. It's because of my brother. He's also a professional soccer player and he's been working with a neuroathletic coach for a long time before. And during this time, I had a lot of injuries. So not this structural injuries. I had a lot of inflammation in my body, especially in the area of pubic bone, adductor pain, a lot of muscle tone, and nobody could really help me. At the end, I've been to different physiotherapists, to different sports scientists and doctors, and nobody really could help me. They all said, okay, it's like an inflammation in your structure. But there weren't any pretty good strategies to really solve the problem. So I had to play with pain and discomfort for a long time. And during this time, my brother worked with this neuroathletic coach and he said, okay, maybe let's try it, give it a try. And then I started the first session with him and it was really awesome because from the first session, I felt pretty good. I had really great success from the first session on. We had 2 or 3 sessions at the end, and since then I don't have any problems anymore in this area. So it really decreased the muscle tone. It decreased inflammation, and I didn't have pain anymore during playing soccer, and that convinced me because during that time I have been studying sports science, and I was discovering, okay, what are the next steps for me? What is the topic I want to work with? And then I started the journey of neuroathletic training.
Okay, yeah, interesting. And could you give us a definition of what neurocentric training is? And how does it differ from traditional strength or coordination training?
At the end, neurocentric training is a different perspective of training of therapy. The most basic definition is focusing on brain and nervous system for increasing performance or decreasing pain. That's the most basic definition you can have or you can give for this specific topic. And that's also the differentiation to traditional approaches like strength training, mobility training, or athletic training. All these training approaches are pretty good. They are focusing on biomechanical structures. So they are focusing on muscles, tendons, ligaments. And there's one piece I think that is missing. And neurocentric training is focusing on that specific piece, and that is the brain and the nervous system and the connection between brain and body. And at the end, that's the biggest differentiation or the biggest difference, that we are focusing on the brain and the nervous system, and we are trying to improve the function of specific brain areas or specific systems we are working with to increase performance or decrease pain. And so it's I don't like the word of holistic approaches because I think nobody knows everything, but it gives us a different perspective and view to different topics or different problems we are faced with. And at the end, we're trying to increase the function of the nervous system to solve problems.
Yeah. Okay. Yeah. It reminds me a bit of, I think, mainly pain researchers who say like nervous system is king in rehab. So it kind of goes into that direction, which is interesting because I think we'll later talk about concrete approaches and also what you mentioned. When people mention the word holistic approach, I often smell, I don't know, non-evidence-based BS. So it's a dangerous word when people use the word holistic. That's my segue to the next question. What scientific foundations support this approach?
At the end, there's a pretty big foundation for this approach because we know a lot about the brain. We have neuroanatomical knowledge, we have neurofunctional knowledge, how the brain and the body interacts. We know which brain structures are involved in generating and controlling movement, and also, and that is one of the most important things for us, stabilizing movement. Yeah, that is something we know. We know a lot about the different systems we are working with. So we know about the visual system, the vestibular system, proprioceptive system. We know the impact of breathing or breath training on different factors. So at the end, it's neurocentric training or brain-based training is an idea or approach to put different ideas together. Yeah, so we are integrating vestibular training, we are integrating vision training, we are integrating breath training, we are integrating the knowledge from neuroanatomy and applied neurology. And at the end, it's the idea to create one approach where we can use everything. So we are trying to put together things we know from a scientific basis from different fields or different ideas. At the moment, there is especially one topic that we don't have that scientific foundation, to be honest, and that's the individualization we are using. So at the end, we are saying that for a specific problem we are trying to solve, so let's say we have 10 people with back pain. We say, okay, we have 10 different nervous systems. And our approach has to be individualized. So we are looking for drills, that's what we are calling the exercises, for drills that are good for the individual nervous system. So therefore we are using a specific test system. It can be a specific test system or a more basic test system. And we are trying to figuring out if the specific exercise or a drill is good for the individual nervous system. And that is something that's pretty hard to put research on, because at the end, research is based on, we have 100 people with back pain and 50 people are doing this approach and 50 people are doing this approach. So at the end, that is something we haven't that scientific foundation for. So we have the foundation for the knowledge we are using, for the systems we are using. We have scientific foundation for the effects of vision training, vestibular training, proprioceptive training, breath training, and so on. But we haven't the scientific foundation for our individualization system. And that is why you cannot find any good. There are some research articles if you are putting it on Google Scholar or PubMed when you're trying to search for neuroathletic training, but to be honest, these aren't research papers that aren't good from a scientific quality. So we are lacking quality here, but the most different thing for us at the moment is the individualization we are using.
Okay, clear. And what are common misconceptions or mistakes you encounter among therapists or coaches when it comes to neurotraining?
So at the end, most of the times people are differentiating between different approaches in neurotraining, but at the end, everything we are doing is some kind of neurotraining, because it doesn't matter if you're doing mobility training, strength training, manual therapy. And I think that's the most important thing to understand and to get trust with the system, is that everything we are doing has an impact on the nervous system. So strength training, at the end, it's also neurocentric training, because strength training has an impact on the muscles, but it also has an impact on the nervous system, on the brain. And I think one of the most important mistakes people are doing at the moment, or have in their mind at the moment, is the differentiation between neurocentric training and other approaches. It's more like, and that is my vision at the end, that we can cooperate them and integrate them, and that we have an approach that integrates the brain and the body. So we have an approach that integrates software and hardware. That's what I'm saying all the time, and I think that's one of the most most common misconceptions we have at the moment. There are a few, but I think that's the most important. And if we can solve this, I think neurocentric training can reach a bigger audience.
Okay, moving on. And I think the next question you already kind of answered, but from your perspective as a neuro coach, what role does the nervous system play in pain and movement limitations?
At the end, it plays the most important role in pain and movement limitations, because we know that pain is an output by the nervous system, by the brain. So if we are experiencing pain, that's an output from the nervous system. So our brain is signaling or sending signals to our body, and that we are experiencing pain and also movement limitations. Most of the times we experiencing pain and movement limitations based on threat interpretation of the nervous system. So our nervous system, the most important task of the nervous system is to survive or to save our survival. And at the end, if our brain feels threatened based on the situation we are faced with, based on the information we are getting from the situation, then our brain says, okay, there's an increase in threat, and there have to be some safety outputs. The brain signals safety outputs to our body. So it decreases our mobility, it decreases our strength and so on, that we are safe, that there's no increased risk of injury based on that we have decreased quality of input. At the end, that's the brain is the most important factor in our body. It's the governing system, and if you are experiencing pain or movement limitations, the brain is always involved.
Okay, the way I came across neurocentric training was through watching tennis, and specifically our German number one Sasha Zverev, who did a lot of neuro training before his matches, and I think Boris Becker and the presentators, they talked about it. That's how I kind of saw what they were doing. But you are using neurocentric training specifically in rehab. Can you give an example, for instance, in a patient with, I don't know, knee pain or shoulder pain, how your approach would look like?
Yeah, at the end, I'm always doing like a neuro screening. So I have developed for my own, I call it Neuroperformance assessment flow. So at the beginning of beginning stages of learning applied neurocentric training, I was struggling a lot with the structure I want to apply, and then I built my own test system and my own assessment flow. So at the beginning stage of an cooperation with a person or on therapy with a person, I'm always screening the whole nervous system. So I'm checking gait, for example. I'm checking stability. I'm checking the eyes, breathing, sensation, and a lot of things. So at the end, I have like a neuro profile. So I can say, okay, you have some deficits and dysfunctions in your nervous system, and these are the systems and these are the structures that aren't functioning that well. And then I'm trying to figuring out which system and which structures are involved in the problem. So let's say I have a person with shoulder pain or a lot of muscle tone in shoulder and neck. Most of the times the visual system is one of the most important systems for that, because we know that a specific structure in the brain, it's called the midbrain, that is involved in processing visual information, is responsible for stabilizing head and neck. So that is where neuroanatomy and applied neurology comes into place, because then we know the connections. And so I'm trying to figuring out if we can improve the function or if we can decrease pain with, for example, vision training, based on what I have seen in the assessments before. So it's always, because it's so individual, it's always figuring out where are the problems, where are the deficits in the nervous system, and then how can I integrate different drills to solve the problem based on activation of different structures or training of different systems.
Okay, and continuing with the shoulder example, or with the neck pain example, how do you know if your training, for example, eye training in this person has the desired effect? You mentioned a reduction of pain.
Yeah, so that is where the test system comes into place. That is where what I have mentioned before, the individualization system comes into place, because we are doing a lot of tests before we are trying to figuring out which are the most important drills for this person. And at the end, the cool thing about the nervous system is that it reacts immediately to a specific input. So there's no long-lasting effect of some, or when we are doing some drills, because we always need neuroplasticity. At the end, we need plastic changes, but we also have an immediate response of the nervous system to a specific input. Yeah. So let's say we are checking shoulder range of motion, and we also are checking head and neck stability. We are also checking some strength, doing some strength test for shoulder or anywhere else in the body. And then we are doing a specific visual exercises drill. Yeah. Let's say we have seen that your eye on the left side isn't moving that well, maybe in convergence or something like that. Yeah. And then we're doing the drill, and then we're immediately retesting how the drill improves or decreases the performance of your nervous system. So how does the nervous system react to a specific input? Yeah. So if the input is let's say a good input for your nervous system, it's something that decreases the feeling of safety for your nervous system. So the nervous system gives you more mobility, more strength, or less pain. So it's the system that we are using: mobility assessment, strength assessment, or some specific neuro assessments. Then we're doing the specific drill, and then we immediately are retesting what we have tested before. And then let's say, okay, your mobility increases, your pain decreases. And what's the most important thing for me after your pain decreases is what is the impact on the neuro tests? And neuro test means stability tests, vision tests, or some autonomic functions or something like that, or gait. Let's say gait is pretty important. And if it increases performance in gait and stability, I know that's a good drill for you, and that is something we want to integrate into your training or therapy plan. On the other side, if we are seeing some negative responses, so your mobility decreases, your pain increases, your stability decreases, and you are moving more unstable during gait, we know that the input we have given to your nervous system isn't good for your nervous system, because it increases threat and then decreases performance. And that is always the system we are using. And that is something I really appreciate on neurocentric training, because we always can be sure that we are doing the right thing for the person, because we are eliminating the drills that have a negative impact. On a long-term perspective, we have the goal that there is no negative response, and we want to retest the drills that have given you a negative response over and over. But in the first stage, we always want to use drills that have a good impact on your nervous system.
Yeah. I have a follow-up question about the assessments. When I did some pre-reading, as you know, about neurocentric training, and I read the book from Lars Lienhardt, who is the neurocentric coach of Alexander Zverev. So. One thing that I was questioning is how reliable the assessments are that are being done, because it's a whole battery, right? Like you said, you do a whole neuro screening, and I was wondering, like, how much do we know about reliability of all the tests? Because I could imagine if it's a huge test battery, that some tests are pretty decent, and I mean we are kind of known as the test guys on YouTube. Lots of tests are rather worse, or like rather poor in their reliability. Do you know anything about that?
Yeah, so at the end, you have to differentiate between neuro tests and I call it in my system basic tests. So the mobility tests or strength tests, I always call basic tests, and they are on the hierarchy of tests. They are below the neuro tests. And that is where I see a problem in neurocentric training, that we are often always using the basic tests that don't have any really reliability, to be honest. So mobility test or strength test has some limitations, and we have to be honest with that. So that is why I'm also when I'm educating people, saying to them, okay, focus on the neuro tests, because the neuro tests are tests we know from neurology. We are testing gait, we are testing your cerebellar function, we are testing your eyes, we are testing your stability. And these tests are more reliable than strength and mobility tests. There are also some limitations, and we also have to be honest with that. But at the end, I think we have to have the idea to bring something from theory to practice. So to apply this in a field, in a therapy setting, there have some limitations we have to live with a little bit at the end, but we have to find tests that are the most reliable tests at the end, and therefore I'm using the neuro tests. For example, let's say we are doing some cerebellar tests. We know them from neurology, and we are doing the basic tests in addition to them. Yeah. At the end, it's easier to interpret basic mobility and strength tests, and that is why we are using them. That is why they are discovered in the books. That is why you see these tests in newsletters and all the stuff you can see about neurocentric training, because it's easier to show them. It's easier to use them at the beginning. But at the end, if you want to be a really good neurocentric trainer or therapist or whatever, you also have to use the neuro tests, and you have to be pretty precise with the neuro tests. But as I said before, the test system and the individualization is the factor we haven't that scientific foundation for at the moment.
Okay, let's move on a little bit and talk about treatment as well. What roles do visual, vestibular, and proprioceptive inputs play in your training, and how do you prioritize them in during the treatment?
At the end, these three systems are the most important system we are using in neurocentric training, because we are calling them the movement control system. So I have said before that the most important task of the nervous system is safety. So to save survival. The second most important task of the nervous system is movement. So the brain, we have a brain to move at the end, and the brain always is working, or the nervous system is always working with 3 steps of a specific process, and that's this input. The nervous system gets input, interprets this input, and decides, okay, what is the movement I have to generate now, I have to create, I have to control now, and then the movement is the output. And the most important input system for movement are visual, vestibular, and proprioceptive systems. So these are our movement control system, and because we are working with the brain, and movement is one of the most important tasks of the brain, these are our 3 most important system in training and therapy. So what we are always trying to do is doing some vision training, vestibular training, proprioceptive training, because then we increase the capability and capacity of the brain to control and stabilize movement. At the end, there's a 4th system I'm using a lot and I'm teaching a lot, and that's breathing. Because I think breathing is a really foundational system, and a good breathing pattern specifically is something that increases the performance at any different level. So there are the 3 movement control systems that are the most important for us in neurocentric training, and I would say breathing.
Okay. And how do you know, or how do you determine which one is more important for patient A versus patient B, for example?
At the end, there are two ways. The easier way is to say, okay, there is a specific neural hierarchy in movement. So the brain, most of the times, the brain specifically uses visual information. So the visual system is the most important system on these 3 movement control system, then the vestibular system, and then the proprioceptive system. So if you want to use the easy way, you start with vision, then you continue with vestibular training, and then with proprioceptive training. The other way is you can test it. You can do the different neuro tests, and then you see, okay, we have some deficits in your oculomotor skills, or we have some deficits in your stability and your vestibular skills. Or let's say you had an injury and we have a sensational problem. You cannot feel warm or cold on your knee after an ACL rupture, for example. Then it differentiates between the different systems. Yeah, so it's based on the tests where you see the most problems in the specific nervous system. So let's say I'm working with a person after knee injury, and I'm seeing some really important sensational deficits, and I'm seeing motor control issues. Yeah, maybe I decide to start with proprioception. And then I continue maybe with vestibular training because I also see some stability deficits. So there are two ways. You can use the hierarchy, vision, vestibular, and proprioceptive system, or you can use the test system and decide which is the most important system for this person.
Okay, and could you maybe tell us how a typical neuroperformance training session would look like, and in this case for an athlete who tries to return to competition?
So there is no typical training session, if you want to call it like that. There's always a specific structure in the training session, and it's always based on testing, but it differentiates between especially how much time I have with the person. So sometimes I have 30 minutes, sometimes I have 60 minutes, or sometimes I have longer. Most of the times with performance athletes, I have longer than 60 minutes. I have as long as I want. Then I'm testing the whole nervous system. Yeah. Then I'm doing the whole bunch of tests. I'm asking them some questions about previous injuries, concussions, and things like that. And then we are starting with the whole bunch of tests. So I'm testing gait, I'm testing stability, I'm testing vision, vestibular, proprioception, and I'm doing some additional specific tests, for example, cranial nerves, and I'm testing different brain structures. And then I have a specific neuro profile, and then I'm trying to figure out which of the deficits I have seen relates to the problem we are working with. So for example, I have an athlete with a knee injury, and then in the neuro profile I have 6 or 7 deficits. So I'm asking myself which of the deficits are related to the problems, and then I'm trying to create specific drills based on the problems. Let's say the person has some sensation deficits, then I'm trying to do some sensation training. Or I'm doing some vision training based on what I have seen. Or I'm trying to activate different brain structures with specific drills. And then I'm doing one drill, and then I'm immediately retesting and looking for a response of the nervous system. And then I'm trying to optimize the drill as long as I think I need to optimize the drill. And at the end I have, let's say, 4 to 10 specific individualized drills for the athlete. And that is something he has to do on a regular basis, on a daily basis, because then we need neuroplastic change. That's when I'm working with an athlete. If I'm working in a therapy setting, it's a little bit different because most of the times I have less time. So I'm decreasing the amount of tests I'm using. And in a therapy setting, sometimes it's also easier because with the specific symptoms and diagnosis that people have, you often know before you're testing which systems are the most important, and then you can switch between the different systems and you have a clear way where to work on. But at the end, it's about testing and then trying to generate specific drills. That is the homework for the person.
All right. Yeah. And what effects do you observe in performance-oriented athletes through neurotraining? What changes specifically, and how do you measure those?
At the end, the measurement is that you are doing the tests continuously. So I'm doing gait test, stability test, and so on, and I'm doing them in every session. And then I'm trying to figuring out what are the tests we have improved and what are the tests we haven't improved. And at the end, with a performance-oriented athlete, my goal is that he has the perfect nervous system. We will never reach that level, but at the end, that's the goal. So you have to be perfect in every test. That's the vision. That's the idea. So if we see some deficits in some tests, I want to improve them. And at the end, in the next session, we are testing these tests again, and we are seeing if you have some improvements. I think the most important effect I'm seeing with performance-oriented athletes is the increase in stability and the decrease in the risk of injury. Because we are, especially with performance-oriented athletes, we are working on the stability system, with vision training, vestibular training, and the different brain structures that are involved in reflexive stability. And reflexive stability is one of the most important things for athletes, because at the end, I'm not the performance coach for the athlete. I'm not the head coach of the team. I think my most important task or value is if we can bring the athlete to a level where he isn't injured for a long time, especially in youth athletes. If a youth athlete has the ability to train and playing games or over a series of many years, that's the way he can develop. Yeah, and that is my most important thing. You also see some changes in performance. Yeah, if you do some vision training, we know from scientific research that it increases agility. And for example, in soccer, that's where I'm working, agility is the most important factor for performance in soccer. So if you're doing vision training, you are increasing agility, and that is awesome. Yeah, that is because it increases his performance. But for me, the number one thing is to increase stability and decrease the risk of injury. That's always the task or the vision I see for myself in the work with athletes.
Okay, and maybe can you describe what athletes tell you what they feel after a couple of weeks of training, or I don't know how long it takes till you see an effect, but because you're looking for the tests basically, and that they perform better on a test, but what is it that athletes tell you, like what they feel on the pitch or on a court?
At the end, there are many different effects you hear from different athletes, and it's also where the athlete focuses on at the moment, to be honest. So the athlete is coming to you with a problem or with a goal, and then we're trying to reach the goal. Yeah, but if you want to categorize it or want to hear the most important or the most significant effects you can hear from athletes, I would say, especially in soccer, is that they are reacting faster, and it feels like that the game is a little bit slower. And that is, at the end, that's because we increase agility with vision training, peripheral awareness, depth perceptions, and things like that. So the brain is processing faster, your visual system is functioning better. So you have more and better visual input, which increases your performance in soccer. That's pretty important. So some specific performance increases in performance, or some effects to performance, especially, as I said, the game is slower and I'm processing faster. That's one thing. Then you often hear about stability and the decreased risk of injury, that you hear, okay, I had a situation in training on a game where I thought, okay, that was dangerous. Maybe in previous years I would have an injury now, but I haven't, because my system is able to handle it. It's more stable, so an increase in stability in some duels, or a decrease in risk of injury. You hear that in different words, and I would say these are pretty important effects. And also, what I sometimes hear, what I also are experiencing, is a decrease in muscle tone. Yeah, so better regeneration and decrease in muscle tone, because muscle tone is something that is set by your nervous system, and sometimes we have this view of we need a high muscle tone in athletes. They need a lot of muscle mass and a certain amount of muscle tone to perform. But I think sometimes we need less muscle tone and more relaxation. And that is something you also can hear sometimes from athletes.
Yeah. No, but it's very interesting, especially what you mentioned in the beginning about that the game feels slower. And I think in a lot of different games, not only soccer, but also tennis or other sports, I think the higher you go, the faster the game is. And the ones that can adapt to the speed of the game are the ones that can climb the ranks, right?
Yeah. So that is something the scientific research shows us at the moment. That's something I've written my master degree about as well. That especially in soccer, but also in different sports. I'm not an expert in different sports, but I think you can see it as well, is that the physical abilities are pretty high at the moment. So these are pretty awesome athletes. They are pretty fast, they are strong. And what I think differentiates the good from the best is how fast they can handle, how fast they can react, and how good they can handle with the ball, for example. And I think in the future, this will be the most important factor in training. We already know how we can increase speed, how we can increase strength, and how we can increase endurance on a pretty good and specific level in high-level athletes. But where we have to increase our capacity and quality in training is to train at the end, to train the visual system, to train the brain to react faster, because it's nice to be fast, but you also have to react fast. Yeah, so in sports like handball, basketball, or soccer, there are milliseconds that are responsible for success or not. And if you can react a millisecond faster than your opponent, you are also physically fast, that is the perfect combination. And I think that is, at the end, that is what agility says. It's a combination on physical speed and, let's say brain speed or cognitive speed. And I think that will be one of the most important factors in training in the future in a lot of sports.
Okay, my last follow-up question on elite sports, then we'll move on. How common is neurocentric training or neuroathletic training in elite sports? Like, do you have any numbers? Or, I mean, with the tennis, I just saw it with Zverev, no one else. But how common is it according to your opinion?
I think it is more common than we know in public, because a lot of athletes are using it without putting it on social media or somebody else. They're doing it for their own. I know it from tennis that a lot of the best tennis players in the world are using neurocentric training a lot. I know that Novak Djokovic is using it a lot, but they don't want to show their secrets of success at the end. That, especially in tennis, it looks like this. So a lot of elite athletes are using neurocentric training or some kind of neurocentric training, like cognitive training or vision training. We also know that in, for example, the NFL or NHL, they are using vision and vestibular assessments and training for concussion. Concussion is a big topic in these sports, and that is also part of neurocentric training. So at the end, if somebody is testing your visual and vestibular system after a concussion, I think he's doing neurocentric training and therapy. And in Germany, especially in soccer, it is increasing a lot in the last few years. There are not many teams at the moment that are using it, but I think it will increase the number of teams. I don't have any specific numbers, but there are more elite athletes that are using neuroathletic training at the moment that we know. That's great. And I think it will increase a lot more in the future, and it will also increase a lot more in the therapy and training world in the future.
Okay, cool. You already mentioned that you're not the performance trainer or the performance coach of an athlete. So how do you integrate neurocentric training with other approaches like the traditional strength training, mobility work, or conventional therapy?
And so at the end, you also have to differentiate the different settings you are working with. So if I'm working with an elite athlete, he has his strength coach, he has his athletic coach. So I'm not responsible for physical ability. So I'm only working with my neuroathletic approach at the end. So I'm looking on the brain and I look how can we increase the function of the brain. But you can definitely integrate, and that is what my vision also is in the therapeutic setting, in educating and teaching therapists, that you can integrate it into different settings. As I mentioned before, every system or approach you're using is some kind of neurocentric training because you have some impact on the nervous system. So at the end, I think it would be of big value if we integrate neurocentric ideas into traditional ideas. And that is something we can really do. You can test manual therapy. You can test if a person or the nervous system of a person reacts better to warm or cold or deep pressure or not so deep pressure or something like that, or vibration. That's something we can integrate into manual therapy. And I hope that will be part of the future. And you can also integrate it into mobility or strength training, especially strength training, because there is something that's called sensory priming that I'm using a lot here. Sensory priming, in my opinion, means that we are priming the movement. So for example, we want to train a squat or a lunge with a person. And then I'm always looking for what systems are involved in this specific movement and how can we activate these specific systems before we are doing the strength exercise. So that is something I'm using a lot, that let's say I'm activating your vestibular system in a certain way, in a specific way, before you're doing your lunges or your squats. Then I'm increasing the performance of your brain. I'm training your software before you are training your hardware. So that is where you can integrate neurocentric training into strength training. You can integrate neurocentric training into mobility training. And like the same way, you can look at the structures in the brain that are responsible for flexion or for extension. And then you can integrate it into these different approaches.
Okay. And what would you recommend to physiotherapists who want to incorporate neurocentric elements into their daily work without taking a full course right away? Are there any simple assessments or interventions they can try?
Yeah, at the end, I think there are 3 steps you have to go to be a good neurocentric trainer. At first, you have to trust the nervous system. Yeah, you have to understand and trust the system that we can decrease pain in your shoulder by doing a vision exercise. And that is where you have to learn something about the nervous system, where you have to deep dive a little bit into neurofunctional theory. So you can read some books. There is some theory in the books, but I think there isn't enough theory to really understand the value of the nervous system. So there are like articles, newsletters. I think there are also some free courses you can use. For example, we have also a free course where the theory is explained. And I think that is the first most important step, to trust the nervous system. Yeah, to trust the system that you can decrease pain anywhere with, for example, a breathing drill or a vision drill or an activation of the nervous system. And then there are a lot of free resources, for example, books, because the next step is to trust the test and retest system. Yeah. Therefore, at the beginning, you have to use the basic mobility and strength tests that aren't reliable as the neuro tests. But I think to start with neurocentric training, it's a good way to use this test. So you can use books, you can use YouTube videos, you can use newsletters where you learn about tests. One of the tests I'm using a lot, or I'm teaching a lot from the basic test perspective, is like whole body rotation, head rotation, spinal flexion. So where you want to bring your fingers to the floor, or some strength tests like whole body rotation, strength test, shoulder abduction, hip abduction. Let's say you have these 6 tests with a person, and you see some deficits in some of the tests. So you see a decrease in the rotational capacity to the left, or your cervical rotation to the right, or some decrease in hip strength and shoulder strength on the left side, for example. Yeah, you don't have to interpret them, because you cannot interpret them. We can only interpret the neuro tests, but then you have a specific basis where you can work from, and then you can use different neurocentric exercises. Yeah, and there are a lot of neurocentric exercises out there as free resources. Maybe one of the most important things you can use, what I can show here, is like an pencil push-up or an eye push-up. Yeah, that is one of the most famous neuroathletic exercises you often see and you often hear. That's very, very train convergence capacity. It's a specific visual skill. That's where you bring an object closer to your eyes and your eyes are converging. There are some different ideas, because why this is one of the most important drills. But at the beginning, you don't have to know something about the drill. You just have to do the drill, and then you have to immediately retest. And if it's better, great. If it's not better, you can adapt the training with doing it with one eye or doing it seated. And I think that is the second step in learning about neurocentric training. At first, trusting the nervous system, then working and trusting the test and retest system. And then you have to go the big step, and that is where you can work on the nervous system, on a structure, with a specific structure, with a specific amount of tests and a specific amount of drills. Yeah, that is then this is the big next third step, to integrate neurocentric assessments, neuroassessment, and all the neurocentric drills. Therefore, I personally think you need a foundational education for the first 2 steps and to integrate some neurocentric training approaches into your training or therapy. You don't need an expert that shows you that.
Yeah, it's the pencil push-up always reminds me of my mom back in the days. Like, don't do it; your eyes will become stuck. So it's maybe another myth that we can bust today. That it's actually a good thing and a skill to be able to cross your eyes.
But there are some other drills you can use if you don't want to use them. I personally think that, for example, training accommodation, for example, as a vision skill is something we should integrate in the training for a lot of people, because we are working a lot of in home office on different screens, and we are losing the capacity to look in a far distance. So doing eye jumps between a far and a near object is a pretty important drill you also can do if you don't want to do an eye push-up.
Yeah. Okay. And how long does it take for someone until, because you talked about neuromodulation, that is the direct effect, but also neuroplasticity, that we can really improve those skills. How long does that usually take? Because it usually takes like 6 weeks till we have like some muscle adaptation, for example, or strength adaptation. How long does that take on average?
We cannot say that definitely, because there is something that's called plasticity of neuroplasticity. So every system is plastic on a different level. So it depends on your age. It depends on your lifestyle. So let's say we have a person that is 30 years old, or we have 2 persons that are 30 years old, and the one is drinking a lot of alcohol, is obese, and has some pretty bad eating behaviors in comparison to a person who is doing a lot of exercises, doesn't drink or smoke. These people are plastic on a different level. Yeah. So it depends on the person. I personally can say you see some changes in an area of 3 to 6 weeks. And you see some pretty important long-lasting changes in an amount of months between 2 and 6 months. But it depends on the individual nervous system, so we cannot say this. So the most important things for neuroplasticity are age and lifestyle.
Okay. I have 2 questions left for you. And the first one is, what's the most striking change you've witnessed in a patient or athlete thanks to your neurotraining?
It's pretty hard to say. I always say that the patient who benefited the most from my training and from neurocentric training am I, because I'm doing neuroathletic training and neurocentric training for more than 5 years now, and I don't have any pain. I'm still playing soccer on a decent level, not that high level, but on a specific level. And I'm not injured. I'm always fit if I have time, if I don't have to work. But I have found some pretty impressive effects for my own, and that is what drives me day by day to work with people, to teach this approach to different people. And if you want to hear the effect for a specific person that also got me a little bit emotional, to be honest, is a person who came to me with an ankle injury. And the ankle injury wasn't a problem. We solved the problem in about 1 or 2 sessions. But then she said, okay, I have a specific area in my tongue that I cannot feel. I'm always biting on my tongue. I cannot feel the tongue. And that really drives me crazy, because I really wanted to work on this. And then we did some tongue drills. We did some vagus nerve stimulation and all the stuff we have done. And after, I would say, 3 or 4 months, she came to me and she said, I'm feeling awesome. There's a specific part in my tongue I cannot feel at the moment, but it decreased a lot, but I'm feeling awesome. They were in my previous life, if you want to say it like that, if I had stress and then I got to vacation, for example, I always got ill. And I was stressed all the time. I always got ill. I wasn't able to eat everything I wanted to eat. I got some problems, and everything of that is gone. And that was, at the end, I think, if you ask me, that is one of the most important, most significant effects I can imagine.
Right. Yeah. Thanks for sharing. At last, what books, courses, or resources would you recommend to someone just getting started with this topic?
Yeah, so as I said before, there are these 3 steps I think you have to go to be a good neurocentric trainer. You can use free resources like YouTube videos, like books, but to be honest, I think you have to be cautious at the beginning in applying this. I have seen this a lot, that when people come to our courses, for example, they say, okay, I have bought 3 of the books and I'm using neurocentric training, and after, for example, the 2-day workshop, they said, okay, that completely changed my opinion and my view on neurocentric training, because it's a different level of applying it when you get taught by somebody who has done that before. But you can use books or free resources. I think at the moment there are some free online courses you can use where they go more into depth from the theory. Yeah, and I think that's a little bit better than just focusing on practice, only focusing on practice. I think it's an approach that lives from practical application, but you have to know some basics. So some books, free online courses, some newsletters where you learn about the theory and then applying it, and then you can use the books. And at the end, there are more and more resources. We also have resources you can use at the end. I think you have to decide how deep you want to go into neurocentric training. If you want to apply it a little bit, you can stay with free resources. If you really want to know about the approach and really want to apply the approach, you have to do some foundational education.
Yeah. Okay. I will definitely put a link to your website into the show notes or the transcript. Is it available in English or just German?
At the moment, it's only available in German. But maybe if there are a lot of interested people, we can change that fast.
Yeah. Okay, all right. We're coming towards the end of our podcast, and I always ask every guest, is there anything that you would like to add to the podcast that we haven't touched on, or that you would still like to discuss?
To be honest, I don't think so. I think we have covered a lot. I personally think, and I hope you have heard that and you have seen that neuroathletic training is the one thing I love. I love to talk about. I love to teaching. I love to applying, and I really hope and I hope that this podcast will help us here, and the other experts are helping us also, that this specific approach is increasing. It's getting more public. It's getting more applied, especially in a therapeutic setting. I think, and as I said before, in the athletic world, it will definitely increase in the amount of people that are using it. But I think that especially in a therapeutic setting, we can also apply a lot of things from this approach, because everybody who is coming to us in a therapeutic world has a brain, and the problems we are faced with have always something to do with the brain. And so to have a perspective to test and train the nervous system is something from a pretty big value.
All right. And where can people find you if they want to get in touch or learn more about neurocentric training?
So as you said, on my website, but I'm also because I'm a young people. I grew up with iPhone and and things like that. The most easy thing, or the easiest thing, is to get my number, to call me or to send me a WhatsApp. That's the fastest way. Or you can send me an email if you want to know something about our courses, our educational system, where we teach the neuroperformance therapy concept in a whole. Yeah. So you can look on our website on Neuroperformance coaching. You can write us an email or write me an email or a direct WhatsApp message. I will be fast in answering emails and WhatsApp messages. The other way where you can find us is we are working together with the physiotherapy associations in Germany and Austria. So we have some online or live workshops with them. There's also a space where you can find us.
All right. Okay, Yannick, thank you so much for your time and for your knowledge. And it was a pleasure to have you on a podcast.
I have to say thank you. Thank you to be here. It's an honor to meet you, to talk with you. Really thank you for what you're doing and for having me.
You're welcome. And to everyone out there listening to this episode, as always, thanks a lot for listening. And Also, listen to this and other episodes in your own language, including German, French, Spanish, Italian, Portuguese, and Dutch. Download our new and free, it's been around for 1.5 years, so maybe not so new, Physiotutors app. And additionally, you can access the transcript and infographic and find more useful physio content. And if you enjoyed this episode, hit the subscribe button or follow our podcast on Spotify or Apple Podcasts. And also consider leaving a review if you really enjoyed it. And with that being said, this was Kai for Physiotutors, and I'll talk to you in another episode. Bye.